What's up, guys? Welcome back to Patho and Chill. Today, we're going to be talking about a very common disease known as arteriosclerosis. Now, arteriosclerosis is commonly caused by chronic inflammation on those arterial walls, causing them to basically thicken, right? And so as they thicken, they basically start to lose elasticity. And so before moving on, I just want to remind you guys that arteriosclerosis is kind of further divided into three different main types. The first two, not as common as the third one that I'm sure you guys will recognize once we get to it. But so that first one is hyaline and hyperplastic arteriosclerosis. And so this one is basically caused by a increase in protein deposition on the arterial wall lining that basically starts to decrease blood flow, as many of these others do as well. The other one is Mockenberg medial sclerosis, and this one is caused due to increased deposition of calcific deposits on that arterial wall as well. This one is not as clinically significant. It often doesn't really lead to much problem in blood flow. However, it's another cause of arteriosclerosis. And then that last one, that third one, is atherosclerosis that I'm sure you guys have heard plenty of times before. So atherosclerosis is basically an atheroma that occurs on that arterial wall lining. So an atheroma is basically just an atherosclerotic plaque. And so this plaque is known for being soft, yellow, grumous, core of lipid, basically cholesterol, that kind of lines along that arterial wall. It has a fibrous white cap all around it. And so the main things that it can lead to are basically obstruction of blood flow that can lead to potential myocardial infarcts if it goes to the heart or to the brain, that we'll talk about at the end of this video. Another thing that can happen is a thrombi formation. So if it breaks off, then it could potentially form an emboli that can move around the body and basically form and cause another obstruction of blood flow to whatever specific organ it kind of attaches to. And the last thing that could potentially happen from atherosclerosis is an aneurysm, and is basically caused by the weakening of the blood vessel as this lipid deposits keep basically depositing on there. And so it basically causes a dilation of that arterial, of the artery, and makes it prone for rupture that could lead to hemorrhage. So now atherosclerosis can definitely be preventable, but there are also non-modifiable risk factors. So first we're going to talk about those non-modifiable risk factors before moving on to the modifiable ones. And we're going to start off with age. I mean, it makes sense. As we age, the body's blood vessels basically become a little more weakened, right? They're probably going to be more prone to inflammation. Most people are hypertensive as they keep aging. And so all of these factors can basically lead to the deposition of lipids on the arteries. So it makes sense why increasing age can cause that. Next up, we have family history. So if your mother, if your father had any history of hypertension, that could potentially lead to atherosclerosis. If they have any history of like myocardial infarct, all of these things are very good indicatives of an individual being prone to atherosclerosis. Another one is male gender. So males tend to be more commonly affected by atherosclerotic plaque building up on their arteries. However, women, most of them start to become more at risk after menopause. So that is just kind of one quick little fact about that one. And last but not least, genetic abnormalities tend to also play a very minor role in causing atherosclerosis. Okay, moving on to the modifiable risk factors, we have hyperlipidemia, which is basically the major factor, and that kind of basically goes down to your diet. I mean, hyperlipidemia can also be increased by many drugs, but I think your diet is basically the one that has the greatest potential at affecting this. Diet and exercise. So if you're eating food that is high in cholesterol, has a lot of polyunsaturated fats, or contains a lot of omega-3 fatty acids, and you're basically increasing the cholesterol that you're intaking into your body, which makes sense why the body would start to get saturated with that cholesterol, which leads us to these lipoproteins. So we have LDL and HDL, kind of like little brothers that kind of fight against each other. So LDL is usually the lipoprotein that is known as the bad one. Its main function is grabbing cholesterol from the blood and taking it to the cells. Now that is perfectly fine, and it's actually natural, and it's very much needed within our bodies. However, it's when the cells start to get saturated with this cholesterol that they start telling the body, like, hold on, we already have more than enough cholesterol, we don't need any more. And so by doing that, they basically decrease the amount of LDL receptors that they have on their cells. And so this prevents that LDL molecule from taking cholesterol to the cells. But what does that cost? Well, now you have an increase in concentration of the LDL protein and thus cholesterol in the blood, because it can't get it to cells. And so when cholesterol starts to build up in the bloodstream, that is when it obviously becomes more prone to causing a plaque on the actual artery. And so then on the other hand, you have HDL, which is the other brother that will like to take cholesterol from the cells to the liver to basically get it metabolized and excreted from the body. So it is known that exercise, the more you exercise, the more prone you are to creating and synthesizing this HDL lipoprotein. So this is why both exercise and diet are huge modifiable risk factors for developing atherosclerosis. Aside from that, we have hypertension. So, I mean, this is kind of like on the point of like, is it really modifiable or is it not modifiable? It is modifiable in the end, because once again, lifestyle can heavily affect whether you're going to develop hypertension or not. However, hypertension is a whole other disease that is very much linked to your family history. So that's kind of where it falls on that gray line. However, yes, hypertension, it makes sense because you're basically, the prolonged chronic increase in blood pressure is going to be basically causing inflammation. It's going to be harming those arterial wall linings. And so that's kind of where it leads to a very common hypothesis known for atherosclerosis, which is the response to injury hypothesis. That is basically as inflammation increases on the arterial wall linings and they starts to cause an injury to them, well, the body's going to naturally want to heal that injury. And so it starts to send in a lot of cells to basically start repairing this injury on the blood vessel lining. And so you have macrophages coming in, you have other types of white blood cells. And so as these cells arrive to that location, they're actually prone to picking up these lipoproteins, LDL, and also cholesterol. And that's how the actual plaque starts building up. So that is kind of where hypertension gets put into atherosclerosis as a modifiable risk factor for it. Additional risk factors that can also be modified are smoking cigarettes. So that's this one as well. Smoking is known very much for decreasing the body's ability to heal. And so as we were just talking about that response to injury hypothesis, if we don't have that ability to heal, well, then the blood vessels are going to be more prone to picking up that LDL and just cholesterol flowing in the bloodstream, thus leading to atherosclerosis. And then meanwhile, diabetes mellitus, especially type 2 diabetes, this one, as we basically have increased blood glucose levels and also hyperlipidemia in the bloodstream, it only makes sense why it could have an increased risk at causing atherosclerosis. So with that being said, before we end the video, I kind of want to finish off with, well, what is like one of the worst things that can happen from atherosclerosis? And I've kind of already alluded to the fact that you can get a myocardial infarct if you actually get complete blockage and occlusion of the blood vessel in like the coronary arteries going to the heart. So obviously that is not good. And another thing that can happen is a stroke. So that's basically a cerebrovascular accident in which the blood will also stop flowing to the brain. And so we can have two different types. There's like the hemorrhagic stroke or there's an ischemic stroke. Hemorrhagic stroke is much less commonly seen than ischemic. And this one's basically due to an aneurysm forming in a blood vessel in the brain that will then rupture. Meanwhile, on the other hand, we have that ischemic stroke that is, once again, as we've been saying many times, basically blood flow will not be able to go to the brain, and that means no oxygen to the brain, and so then the brain will kind of get that stroke. Anyways, guys, if you enjoyed this video, please make sure you hit the like button down below. Go check out my other videos. I have a few posted here and there. I know I've been absent. I've been kind of busy with other things here and there, but I'm going to try to upload a little more frequently for this account. Anyways, with that being said, I hope you have a great day. I'll see you later, and peace out.